Hi everybody, I'm with Dr. Geraldine Tan, founder and principal psychologist of the Therapy Room. The Therapy Room was founded in 2013 and specializes in a variety of psychological services. In that period of time, Dr. Jerry and her team has helped thousands of patients enter a better mental state. Welcome, Dr. Jerry.
Welcome you too, and you're not too shabby yourself, Mr. Kelvin Lee from the Listening Lab Group, and he's the founder and executive director. And the Listening Lab is one Singapore's largest homegrown audiology and hearing services center.
Service provider, yes.
Service provider,
right.
yes.
Nailed it. Today, we are here to have a conversation with Dr. Jerry about how mental wellness and hearing, the ability to hear, are interconnected in many ways. So, Dr. Jerry, we came from a time where, when we were younger or starting out as professionals, nobody really talked about mental health and mental wellness. It was kind of like something that was hidden in the landscape of social psychology, right? But nowadays, you can't stop hearing about mental wellness, and and all of us find it's a good thing, isn't it, right? So where do you feel that these changes started to happen in this whole landscape for mental wellness?
Many years ago, where Singapore is looking into psychology, mental well-being, but there was a lot of taboo surrounding it, and people were very fearful to talk about it. But then when COVID hit, we really had no choice but to talk about it, because basically everyone was anxious, was fearful. There was a lot of changes that we needed to deal with. We could not run away from mental health issues or mental well-being because we were not well. We were not physically unwell, but we were emotionally, mentally unwell.
There was a landmark study in about 2014 to 2015, where data scientists kind of were able to link unaided hearing loss with an increased risk of dementia by, if I'm not wrong, about 2.1 times. And then a separate study was then conducted by actually Ng Teng Fong Hospital in Singapore, which replicated this study and drew the same conclusions as the original study from the States. And that's when I think we started to realize that actually hearing had a huge part to play in deferring the impact of dementia on society, especially as Singapore was getting older and aging very quickly. The first thing that really affects hearing loss, is actually communication. And who do you communicate with? So the people you communicate most with is your family, your friends, your loved ones. You tend not to want to talk to your enemies or people that don't like you so much, right? So it's with that particular close group that hearing loss has a direct impact on. Because once the communication is not so easy and there's more struggle to do it, then people tend to withdraw from it because they feel they get judged. Mishearing causes a lot of misunderstandings. There's this general sense that, I'm worried I'm being perceived as being a bit slower, a bit stupid maybe, and that has an impact on communication. It has impact on your social life, and therefore it impairs your ability to socialize with your most loved ones.
When you have your grandma and your grandma goes, huh? After you ask her something or you tell her something, and she goes, I didn't hear what you said, can you repeat it again? And then you repeat it again and you get frustrated. You get more and more upset. Or you see something to someone and they don't do it. So the people around you get more and more frustrated. The person that is unable to hear starts to withdraw because they feel shameful. They feel ashamed of their inability. They feel embarrassed that they have not caught whatever that was said to them. We know depression, one of the signs and symptoms is social isolation also. So the withdrawal, that mimics that also. So they plunge themselves into that dark abyss. So then we do have the research, and most recent research that was done in 2024 by the Journal of Translational Medicine, where the psychiatric conditions with people who have hearing loss is 2.6 times, actually. Yeah, and we're talking about depression, we're talking about anxiety, we're talking about, clinical disorders that are 2.6 times higher than those that do not have hearing loss.
Adult son comes home, reads his dad who's watching TV, hey dad, I'm home. And then the dad doesn't hear.
Yep.
So the son thinks maybe dad has a bad day. So he then says again, hey dad, I'm home. And dad doesn't hear again, right?
Yeah.
And then, okay, fine, maybe he's in a really bad mood. So he takes the stuff and he walks past him, past the TV to the room. And then dad thinks, wow, you grow so old already. Yeah. 长大了啊，没有家教啊，不用叫我的哦，that kind of thing, right? What kind of guide will you give the caregivers on helping to manage their loved ones' situation like that?
I love this question. So for the caregivers out there, the person that is losing or may have lost their hearing is already in a very uncomfortable position. So what we can do is to try and empathize with them. And, the last thing we want is to nag them. Have you put on your hearing aid? That's not helpful at all because they feel like they are faulted for having to put on that hearing aid. And what happens? They would then forget about the hearing aid, of which they will get scolded. And you would hear the spouse say, I thought you were supposed to put on. And a screaming match ensues afterwards with either the spouse or the children. So it's not worth it. We want to look at building relationships and not destroying relationships. Hearing aids are to enhance your hearing and not decrease your relationships or affect your relationships. So what we want to do is to gently remind them, oh, okay, are you due for maybe a checkup with your audiologist? Or would you like a mental health check-in? Or do you want to talk about certain feelings that you have towards a situation? It doesn't have to be hearing loss because hearing loss impacts many areas of their life.
In audiology, it's easy to do the diagnostic testing and then to prescribe the device. But actually, people don't realize a lot more of the effort goes into the counseling, the day-to-day, the reassurance, the encouragement of getting the client to use the device and interact with people with the hearing devices. So that's a really big part, which is therapy and the rehabilitation.
Losing an ability to hear, and when we lose anything, our confidence is shaken. So I have this pyramid where right at the bottom, you need to know what you have. So self-confidence. So self-confidence is knowing your ability. But if you don't have that and you lose that, so you have that and you lose it along the way, what happens? The next level is self-esteem. Your self-esteem is also shaken, is also being taken away. You cannot trust yourself anymore. So self-esteem is the trust in the abilities, but now I've lost it. And because of that, self-worth, which is right at the top, you lose that worth also, because now you become worthless, you lose a part of yourself. So your self-worth is also depreciated over time. So that's why a lot of people are so upset when they lose their hearing, because it is not just a loss of hearing, but a loss of many layers of self, from the self-confidence to the self-esteem to the self-worth.